Have you noticed that food just does not taste the way it used to? The coffee you have enjoyed for years seems weaker. Soup needs more seasoning. Fruit tastes less bright. Meat feels less satisfying. Even your favorite meal may seem flat, almost like someone quietly turned down the flavor. And after 60, it is easy to explain it away. You may tell yourself, that is just aging, or maybe my taste buds are not what they used to be. Sometimes, age does play a role, but losing your sense of taste after 60 is not always that simple. It may be a quiet signal from your body, not something to panic about, not a diagnosis, but something worth paying attention to, because taste is not just about the tongue. It is connected to your sense of smell, your saliva, your mouth, your teeth and gums, your medications, your nutrition, your blood sugar, and the nerves that help your brain understand flavor. So when food suddenly tastes bland, bitter, metallic, or just off, the question is not only, what happened to my food? The more useful question is, what changed in my body? Many adults over 60 notice that flavors become less sharp. That can happen gradually with aging. Smells may not seem as strong. Foods that once felt rich and satisfying may start to feel dull. But here is the part many people miss. A person may think they are losing taste, when the bigger problem is actually smell. That may sound surprising, but flavor is built from both taste and smell. Your tongue detects basic tastes like sweet, salty, sour, bitter, and savory. But the deeper flavor of coffee, roasted chicken, soup, fresh bread, oranges, herbs, or vegetables comes heavily from smell. That is why food often tastes flat when you have a cold. Your tongue may still be working, but your nose is not helping your brain build the full flavor. After 60, this matters more than people realize. When food stops tasting good, appetite can drop. Some people start eating less. Some avoid protein because meat tastes strange. Some drink less because water tastes different. Others begin adding more salt or sugar just to make food feel normal again. Over time, that can affect nutrition, hydration, energy, muscle strength, and overall health. So taste loss is not just a small annoyance. It can change the way you eat and the way your body is supported every day. One common misunderstanding is that there must be only one cause. People often assume, my taste buds are wearing out, or this is just old age, or I probably need a supplement. But taste changes after 60 can have several possible explanations. One possible reason is normal aging. The senses may become less sensitive over time. Food may still have flavor, but it may not feel as strong as before. Another common reason is dry mouth. Saliva does more than keep the mouth comfortable. It helps dissolve food particles so the taste receptors can detect them. When the mouth is too dry, food may taste dull, sticky, bitter, or metallic. Chewing and swallowing may also become less pleasant. Dry mouth can happen for many reasons. Not drinking enough fluids may contribute. Mouth breathing may contribute. Certain medical conditions may contribute. Diabetes can sometimes be linked with dry mouth. And in older adults, medications are one of the most important things to consider. Many prescription and over-the-counter medications can affect taste, either directly or by reducing saliva. This can include medicines used for blood pressure, allergies, depression, anxiety, pain, bladder symptoms, and other common conditions. But this is not a reason to stop taking medication. Never stop, skip, or change a medication on your own because food tastes different. A safer step is to ask your doctor or pharmacist, could any of my medicines be affecting my taste or causing dry mouth? That one question can be very useful. Sometimes the timing matters. Did the change begin after a new prescription? After a dose change? After adding an over-the-counter medicine? A healthcare professional can review this safely and look at the full picture. Another possible reason is oral health. The mouth is not separate from the rest of the body. Gum problems, tooth decay, dentures that do not fit well, mouth sores, oral infections, or yeast overgrowth in the mouth can all affect taste. Some people notice a bitter taste. Others notice soreness, burning, white patches, bleeding, or pain when eating. These are not things to simply tolerate. For seniors, mouth health affects eating, comfort, nutrition, and quality of life. If your mouth feels different and your taste has changed, It is worth bringing up with a dentist or a healthcare provider. Recent illness can also play a role. A cold, sinus problem, allergy flare, or viral infection can affect smell and taste. A sudden loss of taste or smell can happen with respiratory infections, including COVID-19. Sometimes taste improves as the illness improves. But if the change is severe, persistent, or unexplained, it should not be ignored. Nutrition is another piece of the puzzle. For example, low zinc levels can affect taste and smell. But that does not mean every person with taste loss should run out and take zinc. Supplements are not automatically safe just because they are sold without a prescription. Too much of a supplement can cause problems or interfere with other nutrients or medications. So the safer approach is this. If a deficiency is possible, ask your doctor whether testing or a nutrition review makes sense. Taste also depends on nerves and brain signaling. Your tongue and nose gather information, but nerves carry that information to the brain. Head injury, certain neurologic conditions, or other medical issues can sometimes affect taste or smell. That does not mean taste loss automatically points to something serious. Most causes are not emergencies, but sudden, severe, or worsening changes deserve attention. Now, here is what to watch for. First, notice the timing. Did food slowly become less flavorful over months or years? Or did the change happen suddenly over a few days? A gradual change may fit with aging, smell changes, dry mouth, dental issues, or medication effects. A sudden change, especially with fever, cough, congestion, headache, or other new symptoms, should be taken more seriously. Second, notice your smell. Can you still smell coffee, soap, smoke, perfume, or food cooking? If your smell has changed too, the issue may not be the tongue alone. Third, notice what kind of taste change you are having. Is everything simply bland? Does food taste metallic, bitter, too salty, too sweet? Is there a bad taste even when you are not eating? Those details can help a doctor or dentist understand what might be going on. Fourth, pay attention to your mouth. Do you have dryness, burning, soreness, bleeding, white patches, gum pain, loose dentures, or trouble chewing? These signs may point toward a mouth-related cause. And fifth, watch your eating pattern. Are you eating less without meaning to? Losing weight? Avoiding certain foods because they taste strange? Drinking less because fluids taste unpleasant? After 60, these changes matter. The body still needs protein, fluids, fiber, vitamins, and minerals to support strength, healing, balance, and energy. So what can you do safely? Start by observing, not guessing. Think about when the taste change began. Think about recent illness, sinus problems, dental issues, dry mouth, or medication changes. Notice whether the taste problem is constant or comes and goes. Stay hydrated, especially if your mouth feels dry. Sipping water with meals may help some people feel more comfortable, but persistent dry mouth is worth discussing with a professional. Take oral care seriously. Brush regularly. Clean dentures properly if you wear them. Keep dental visits when possible. And if you have mouth pain, sores, bleeding, white patches, or dentures that hurt, do not wait too long to get checked. When food tastes dull, try not to automatically solve it with more salt or sugar. For some people, herbs, spices, vinegar, lemon, garlic, onion, pepper, aroma, warm temperature, and texture can make meals more appealing. This may be especially helpful for people watching blood pressure, blood sugar, or heart health. And if the taste change is making you eat poorly, bring it up. That is not a small complaint. If food no longer tastes good and your nutrition is suffering, your doctor or dentist should know. Medication review is also important. If your taste changed after starting a new medicine, changing a dose, or adding something over the counter, write that down. Bring it to your doctor or pharmacist. Again, do not stop medication on your own, but do ask whether taste change or dry mouth could be connected. Now, when should you talk to a doctor? You should seek medical advice if taste loss is sudden, severe, worsening, or persistent. You should also get checked if it comes with new loss of smell, fever, cough, congestion, mouth sores, white patches, pain, bleeding, trouble swallowing, unexplained weight loss, poor appetite, or signs of dehydration, and if taste loss appears together with serious symptoms like facial drooping, confusion, trouble speaking, sudden weakness, severe headache, or sudden balance problems, that needs urgent medical attention. Most taste changes are not emergencies, but certain patterns should not be brushed aside. The main lesson is simple. After 60, losing your sense of taste may be part of aging, but it should not be dismissed automatically. It may be linked to smell changes. It may be related to dry mouth. It may involve medications, dental health, infection, nutrition, blood sugar, or nerve signaling. Your tongue is only one part of the story. So if food tastes different, do not jump to fear. But do not ignore the signal either. Notice the timing. Notice your smell. Notice your mouth. Notice your appetite. Notice your medications. And if the change is sudden, persistent, worsening, or affecting how you eat, talk with a qualified healthcare professional, because sometimes a bland meal is just a bland meal, but sometimes it is your body asking you to pay closer attention. If you want clear, calm explanations about the body signals that can appear after 60, subscribe to the channel. Here, we focus on practical health education for aging well, without fear, confusion, or exaggerated claims.